Did you know that there's actually multiple different types of loss? Hey everybody, my name is Dr. Scott Giacomucci. I am a trauma therapist and educator, and today I'm going to outline a handful of different types of loss, although I feel like there's too many different types of loss to try to name or even attempt to name or contain into one video here. So I'm going to primarily focus on really 4 different types of loss. So, of course, most of the time when we think about loss, what comes to mind is the death of a loved one. And yes, this is a type of loss. This is a very real, very common, and a very difficult, most of the time, type of loss to experience. In talking about loss, and especially the death of a loved one, but really this goes for all types of loss, I also want to emphasize that grief is a very normal, common response to loss. And I'm going to do a whole nother video about 8 different types of grief, which I'd encourage you to check out as well. So death and loss are just a common human part of unavoidable aspect of life. Nobody really makes it through this life without experiencing some kind of loss and without experiencing the death of a loved one at some point. So death is the first type of loss we'll talk about. The second type of loss I want to highlight is what we call ambiguous loss. So ambiguous loss is a lot different than death, in that in the experience of ambiguous loss, the loved one is still alive, but the relationship has changed. And there's a loss we experience in that change. So there's 2 different types of ambiguous loss. The first type of ambiguous loss is when the person is still the same person, however, they're physically no longer present in our lives in the way that they used to be. So some examples of this would be a loved one is deployed into the military, or a loved one is doing an inpatient stay in a hospital or treatment center, or a loved one immigrates to another part of the world or moves across the country. That loved one is still the same person, but they're no longer physically present and close to us physically in the way that they used to be. And there's a real loss that we experience when that happens. So this is the first type of ambiguous loss. The second type of ambiguous loss is when our loved one is still physically present, but they're no longer emotionally or psychologically present in the same way that they used to be. For example, when a grandparent develops Alzheimer's or dementia or starts to experience cognitive decline, they're still physically present, but they're not psychologically present in the way that they used to be. And there's a real loss that we experience in relationship with them. These types of ambiguous losses are quite difficult and complicated to navigate emotionally because many times they get unrecognized as loss, or we judge ourselves for feeling grief and we block the grief. This is what we would call disenfranchised grief, and that we feel like we're not allowed to grieve because the person hasn't died. They're still alive, but the relationship has died and changed into something different. So ambiguous loss is particularly common. It's something that we all will experience at some point in some form, and it can lead to some very similar types of grief responses as when a loved one does die. The third type of loss I want to highlight is what we call traumatic loss. So traumatic loss is a bit different than normal loss in that it not only involves a death, but it involves a very sudden and traumatic death. So examples of traumatic loss would be when a loved one dies of suicide, or a loved one dies in a horrible accident, or a loved one dies due to violence or overdose, or unexpected medical complication, or perhaps a pandemic. These are examples of traumatic loss in that not only are we experiencing death and loss, but we're also experiencing a trauma on top of that. We're experiencing the suddenness, the disturbing images, the overwhelming nature of the experience on top of the grief and loss. So traumatic loss is something that unfortunately is particularly common with the folks that I'm working with, especially folks in addiction treatment and addiction recovery, due to the frequency of drug overdoses and suicides and violence. And traumatic loss is a little more complicated to heal from than a typical loss, because usually the trauma part of it needs to be addressed first before the individual can naturally grieve. So, for example, if I have a client who, let's say, witnesses a loved one overdose and isn't able to reverse it, not only is there the death and the loss of that relationship and the grief, but on top of that, there's the traumatic images and the traumatic memory of the individual's overdose and the attempts to try to reverse the overdose that were unsuccessful. And the traumatic aspect of the loss can emerge as classical PTSD symptoms with flashbacks and nightmares and disturbing images and hyperarousal. And these symptoms can really prevent somebody from grieving naturally. So the trauma layer of the loss needs to be addressed before we can get to the grief aspect of the loss. And the fourth type of loss I want to highlight is that loss is really at the heart of all experiences of trauma and really all experiences of change in general, whether it's a loss of innocence or a loss of hope or loss of trust or safety or loss of a part of ourselves, a loss of a role in our lives, or a loss of a house or money or a job or objects. Loss is really inherent in every experience of trauma and in every experience of change. So loss is unavoidable on most of these levels throughout our lives. It's something that we all will deal with, something we all will experience at some point. And so having a little bit of understanding about these different types of loss can help us to validate our experience, especially if it's an ambiguous loss or more of an intrapsychic loss or a traumatic loss, and we're judging ourselves or feeling like we aren't grieving right, or we shouldn't be grieving, but we are. It can really be helpful just to normalize that any one of these types of losses can lead to difficult feelings of sadness, of grief, of shame, or guilt, or anger, or frustration, or numbness, or depression, or anxiety, and that's not abnormal. Like I mentioned at the beginning of this video, grief is a really normal, natural, and healthy response to loss. And it's important that we allow ourselves to grieve in the aftermath of loss. So in the next video, I'm going to be discussing 8 different types of grief. And I'd encourage you to check out this video to learn more.